The Rotary Club of Wausau to order. Thank you all for coming. I see that Rosemary is here and she's on for the invocation. Rosemary, are you up for the invocation, or do you want to pass on the invocation today? I was trying to do this through the messenger and didn't see you. Are you okay to do an invocation, or were you not?
I didn't know I was doing invocation.
That's okay. That's okay. I try to do that behind the scenes if I can, but we'll pass on the invocation today, and just move on to announcements. I don't have any announcements. I'm kind of looking around to who might have announcements. Debbie, do you have anything on your list? No. Dr. Peck does. Go ahead, Brad. You're on.
I just want to, because I know once we get into the meeting and there's questions and answers, I just want to thank the Youth Rotars for the month of February for attending. It was truly just our honor to have you with us. And thank you for representing our motto of service above self at your high schools. We wish you the best. Please apply for the Rotary Scholarship. Excuse me. And we just wish you the best for the remainder of the school year and as you head out into life after high school. And you're always welcome to join us again if you ever come back to town. So thank you.
Yeah, thank you for inviting us.
Ditto from the rest of the members of the club. So thank you, and thanks Brad. So other announcements. John Townsend, do you have an announcement? Okay.
Yeah, I'll follow up Brad's comment. Actually, the club scholarship committee has been formed. I may have mentioned that before, with the likes of Ann Herter-Rapp, Jean Tehan, Kathy Drengler, and myself, along with Sue Nelson from the Community Foundation. And for any of the scholars who did apply, I think they probably are aware that the scholarship cutoff was February 14th. The committee will then start to review the online application soon. In about a month, we'll have our meeting. It'll be virtual to help select, at this point, 5 scholars. And we'll see what develops, but it's an exciting time. And then early in June, as you may recall, we welcome, typically before COVID, the scholars and their parents to a meeting. Last year we did it virtually, and we had last year 8 scholars and parents. I think 7 of them came, and at least 1 to 2 parents. So it was a busy session. It was very exciting. But that's the agenda and the timetable ahead. So we're looking forward to that.
Okay. Thanks, John. Other announcements from anybody?
Well, Matt and Michael, I have a meeting at 1 o'clock. So if we're still going at 3 minutes to or 5 minutes to, I'm going to have to bug out.
Okay. Thanks, Patrick. Dennis, I couldn't tell if you had an announcement or not. No? Okay. All right. I think that covers it. Happy dollars and sad dollars. Because we haven't had many announcements, I haven't had time to round somebody up to do those today. So I'll take it. We'll start with happy dollars. Any happy dollars for anybody? John's got one. Go ahead, John.
I can mention one. Yesterday, the Eagle Scouts of America put on a national live stream on YouTube and Facebook celebration for all the inaugural year class of over 1,000 female Eagles around this country. It was an amazing 1.5-hour production, and featured kids from coast to coast and many guest speakers who themselves are prestigious people with a scouting background. It was really quite impressive. And I think I mentioned a couple of weeks ago as a happy dollar, and I'm going to contribute 20 to this. I saw our granddaughter's picture in the collage of many of the scouts that were displayed. A good number of them, probably as many as 20 or 30 were actually interviewed on the production, but it was an amazing event. I see John Overland here. He probably also saw the event as well. It was really special and very well done. So 20 happy dollars for Katie Martell and her inaugural or her charter year of being one of the first female Eagle Scouts in our country.
And I've got to jump onto that with that. Congratulations. You know, I wasn't able to attend that because I had another scout meeting, believe it or not. But my happy dollars, because we have our 105th annual meeting on Wednesday. And not only is John's granddaughter going to be there to help the opening ceremony, Katie, but 2 other fellow new female Eagle Scouts that are from our area that will have our opening ceremonies, and they'll be recognized locally by Samoset Scouting. So that's, again, Katie Martell, Riley Degner, and Danae Fike. So I'll give $5 per Eagle Scout, so 15. So
All right.
looking forward to that.
John, there's the YouTube show is still available if you want to catch that link.
Very good. Well, between you two, we've kind of hit our quota anyway on happy dollars. So other people want to add to the mix? I scared everybody away now. That was a mistake. All right, sad dollars. No sad dollars. Fess up dollars. No fess up dollars either. All right, I'll add to the happy dollar pot just for 30+ degree weather as opposed to minus 30 degree weather. So that's just worth $1, Debbie. You can put that down. But all right. Any last contributions or comments? Okay, then we'll turn to our speaker. John Townsend's going to introduce him, and he's somebody most of us, I think, are familiar with. Michael Loy is here. So John, the floor is yours.
Great, thanks. So I was going to say is that I'm sure many of you know or have been connected with Mike and many of his civic activities or organizations in our community. But I have a little bio here that I want to share with you in case you didn't know all these special facts. Michael Corson is the Chief Executive Officer for North Central Healthcare, otherwise known by its acronym NCHC, which is nearly $100 million community service program with over 20 locations providing mental health, recovery, and long-term care needs in 3 counties, Langlade, Lincoln, and Marathon counties. NCHC operates several programs, but distinctively operates the adult and youth psychiatric hospital and 2 of the state's of Wisconsin's largest skilled nursing facilities. Some of us have visited that many times. Prior to coming to NCHC in 2014, Mike served as Human Resource Director for the City of Wausau. He is also a fellow of the American College of Healthcare Executives, and he also currently serves, and maybe some of you do that with him, on several boards or commissions and several organizations in our community, including currently he's chair of the Greater Wausau Region Chamber. He's chair of the City of Wausau's Police and Fire Commission, and he's the Associate Capital Campaign Chair for the United Way of Marathon County, which means I think next year, Mike, you're going to be the chair. And he's also a member of the Early Bird Rotary Club, so he knows us well by our Rotary connections. Mike earned his bachelor's degree in health promotions and wellness from the University of Wisconsin-Stevens Point. He received his master's in kinesiology from the University of Wisconsin-Milwaukee and his master's in business administration from the University of Madison. And I just wanted to know if he was going to get his PhD in another University of Wisconsin site in his near future, because he seems to have made the rounds. But Mike, thank you so much for agreeing to come and talk. What intrigued me in wanting to see you join us is not only to have one of our early bird Rotarians share their experience with us, but also to talk about all the amazing changes going on over at NCHC, as we talked earlier about the cranes and the renovations and stuff like that. But the floor is yours, Mike. Thanks so much again for coming and joining us.
Great, thank you, John, and thank you for the opportunity to be with all of you today. I'm going to go ahead and just do step 3 out of a successful virtual meeting today and hopefully share my screen. So just give me a second here. And now for the real trick. Okay, which screen are you seeing? right now?
North Central Healthcare updates.
Okay, and it's a whole widescreen, not the prep slide?
It is.
Okay, great. Wow, 3 out of 3. I hit for the cycle today. That's a success for a Monday. Again, thank you very much for the opportunity to be here with you guys today. I appreciate not being quizzed on the 4-way test. As John said, I am an early bird Rotarian, although I've been on a pretty extended leave of absence since this pandemic hit with my kids and everything else. That morning time frame doesn't work anymore, but glad to be with you guys today. Love the work that Rotary is doing in our community, and I certainly hope to get back to my participation in Early Bird Club here shortly. My goal today is to give you a quick overview of North Central Healthcare in terms of where we've kind of gone over recent years and what's ahead for us. And certainly, throughout the presentation, if you have questions, please feel free to stop and ask questions. Otherwise, at the end, I'd be happy to answer any questions relative to what I covered today or any other questions you have regarding North Central Healthcare. And John did such a fine job with doing an overview of North Central Healthcare. That's about 60% of the work I normally have to do in these presentations, which is describe exactly what North Central Healthcare is. But most of you know who we are in this community and what we do. But I do want to spend a little bit of time of setting context for North Central Healthcare, both from a historical perspective, but then also discussing what's really playing on our organization today and into the future. I'll provide updates pretty extensively on the campus renovations. I know that's one that everybody's interested in. When I first thought about how I want to do this presentation, I thought I could try for one slide and make it conversational, but then there would be no pictures and everybody would be disappointed. So I ended with 40 slides, so you'll get a whole host of things today in terms of photos, and I certainly could do a better job of that. And then I want to just touch on the psychiatry residency program because it is a key component of what we're trying to do to be successful in our community, and then highlight and touch on a couple of points of interest on the importance of community and some of the work that we've been doing in addition to these two big initiatives. I always start with a historical perspective of North Central Healthcare, only to show this faded picture of this gentleman on the bottom. This is Henry Head. He was the first administrator of the asylum here in 1892, and it just continues the legend that I am this man reincarnated and haunting the halls of North Central Healthcare. So as far and extensive as I can make that belief, the better, because people then, will have a general fear around me, I guess. Or
Michael, have you tried the handlebar mustache ever?
I couldn't pull that off if I tried, Matt. So I'm not him reincarnated for sure. But anyway, the picture on the left is of the original asylum for Marathon County. The big point I want to make with this slide in our historical perspective is North Central Healthcare is very heavily influenced by federal, state, and local policy in terms of what we do and how that's changed over the 125 plus years we've been serving our community. Back in 1892, there were large state institutes for families to send individuals with mental illness, addictions, and developmental disabilities to. And families, if you think back to the transportation at the time, often meant that they sent their loved ones to those institutes for the remainder of their life and then become active or remain active participants in their life of their loved ones. So counties petitioned the state for localized funding, and asylums all over the state of Wisconsin popped up. And, asylum has a stigma to it, but this was a beautiful facility and was built on our campus that we are on today, and really was the start of the wider scope and breadth of what we do today. In the 1920s, when we were dealing with the last major pandemic, tuberculosis was a major concern for a lot of people, as well as, obviously coming off the Spanish flu, but tuberculosis really impacted people's lives from an infectious disease standpoint. And we built a Ribview Sanitarium on the west side of Wausau in the industrial park. And that was our really first entry into longer term care. And we operated at the time 50 beds when we first started, and that went over 200 beds and operated there until we brought all of those beds on our main campus later in our history. Fast forward to the 1950s, there was a lot of evolution in psychiatry, and two predominant forces were pushing. One was a move for deinstitutionalization from a federal and just state perspective. They wanted to get away from large institutes because of the conditions and move to a more community-based care model. That was also propelled forward by the fact that there was the first breakthroughs in prescription drugs for mental illness. And so there was this wide held belief that the psychiatric community could move out of these institutions and keep people into the communities. And that's where community mental health centers got their start across the nation with the signing of the Mental Health Act in the 1960s by President Kennedy, which essentially was a belief that the federal government could work with counties to provide local funding for counties to create responsive community mental health centers. And that's how we built a healthcare center here on this campus and really got our start in the wider community-based model that many of our services are today. When that happened, the state of Wisconsin was not overly pleased that the federal government bypassed the state and went directly to counties. And so at that time in the 1970s is when the Chapter 51 statutes were created, and North Central Healthcare became a creature of county government, and the respect that the state made the primary responsibility for the well-being, care, and treatment for individuals with mental illness, addictions, and developmental disabilities to being a responsibility of each county. And those responsibilities could be carried out in any number of fashions limited to funding that was available. And in our community, we chose to be the first multi-county community system of care. Counties were given one of two options. You could be a single county community service program or a multi-county community service program. And because Marathon County had so many resources, Lincoln and Lang Lake counties approached us. There have been many other multi-county systems of care that have dissolved over the history, but we remained one of three in the state. And so what that means in the state of Wisconsin, there are 72 counties, 65 of which are single county community service programs. So every county, when you've seen one community mental health system, you've seen one. They are all very different, which makes it very hard for people to navigate those systems, especially as we start to see our healthcare providers and systems get larger and cover larger geographical footprints. And I do think that it is a challenge that will propel the state to look at more regionalized options going forward. Fast way forward to when I started here, which will be 5 years ago this month in my role as the CEO. In 2016, as I alluded to with other multi-county community systems of care, this multi-system county system of care looked at whether or not it should remain multi-county in 2016. And it nearly dissolved, but in September of 2016, they found that the relative wisdom of staying together made sense in a lot of respects and committed to having a new tri-county agreement in December of 2016. So Jeff Zerini, who is a Rotarian as well and was a board chair for this organization for 5 years, has been my partner in a lot of this and was there from the beginning. And just ended his term on our board at the end of 2020. But we were able to get a new agreement and move forward. So with that, we had to paint a vision of what we needed to accomplish in the future to make this partnership even stronger. And we created what was called the 5 to 50 vision. And it was a fun play on the timeline. We were celebrating our 45th anniversary as a multi-county system at that point. And over the next 5 years, we wanted to identify all the things that we needed to do to set us up for the next 50 years. And why that was a good play on the timeline was that we had a number of neglected capital needs on our campus that needed to be done in a very comprehensive and big way. And so to think long-term in that strategic planning was essential for us to be able to move forward and address some of those things. There's many other facets to that vision, but essentially the campus renovations were a big component of it. As I started in 2017, we were 10 years into the aquatic therapy program trying to get a new pool. The Warm Water Works group had been working at that diligently and had stalled. And it was really the last attempt for us to be able to get that project done. The county board dared us to raise $3 million of the $6 million project in 6 months, which started in March, and we had to raise $3 million by September. And thankfully, to the generosity and support of the pool from this community, we were able to do that in about 4.5 months, and that was allowing a future for the pool. So everybody can remain in the pool. We were able to get through closing of the old pool and opening of the new pool, and I'll show you that in just a minute. But that was really the first big piece that we had to knock off in the 5 to 50 vision, was whether or not the pool was part of it. The second piece was what to do with Mountview Care Center. Counties do not have to operate skilled nursing facilities, and they're historically not very good at doing that across the state of Wisconsin. Much as they're not very good at providing acute care hospitals as well. There used to be many county-run acute care hospitals across the state of Wisconsin. I believe they are all but gone at this point, because again, healthcare is changing in a rapid and dynamic way, and counties just couldn't keep up with those changes. There are about 30 skilled nursing facilities operated by counties in the state of Wisconsin. In February 2017, we started a process of whether or not it made sense for Marathon County to continue to have a skilled nursing facility in our community. At the time, we had about a 210-bed skilled nursing facility, and we decided that it did make sense, and the long-term vision for us was that we should have a skilled nursing facility of 176 beds. And that was the next big component of that 5 to 50 vision that was laid out. Finally, we got the green light with a broader project. In April of 2017, while the pool was going on and the Mount View Care Center decision was being considered, we moved forward with a master facility planning process. So knowing that we had a ton of work to be done on this main campus, and with it being over 500,000 square feet, we wanted to answer 2 essential questions. One was that could we do this in a comprehensive manner and still operate? And second, could we do that and be able to fund those renovations through operational improvements and revenue enhancements? And the answer to both of those questions were yes, which meant that we could do this project all at once over a series of phasing in a number of years, and that we could pay the debt related to this campus renovation project from operations without going to county tax levy or taxpayers for that funding. So that's a win-win-win situation for everybody that was involved. So in May of 2018, we had the resolution that authorized the $73 million bonding expenditure, and we moved forward with the design work, hiring a firm out of Janesville, and that design work was completed in March of 2019. So with that, I'll just stop, and then I'll let you know that I'm going to come back to where I left off right there relative to our renovations. But more than that, I think it's important for me to stop and talk a little bit about the externalities that are playing on North Central Healthcare, and really how do you design a building around that. The world around us, whether we like it or not, is changing or is dominant on what we're able to do in our communities. And there are 5 things that I think are really pressing on this organization, and will continue to do so going forward, that we need to keep in respect to the decisions we make going forward. Many of you are involved in this reality of our world, which is labor demographics are going to make our world a lot less convenient and expensive in the short term. There are just not enough workers that are available for us to fill vacant positions today. And even if I wanted to double the size of this organization, there's no way that I'd be able to staff it with the current labor demographics that are available to us. Where this plays for all of us in all of our businesses in our community is, I believe, that makes life a lot less convenient. Access will start to get restricted, and certainly costs to do business will go up as people compete for the scarcity of labor resources. In the short term, I think that impacts 24/7 businesses like North Central Healthcare the most. If you have a worker that has the choice between an open job on the night shift and the day shift, most times that person is going to take a day shift opportunity. And so I think for healthcare especially, for our region, this is going to be one of the greatest challenges that we face, and you'll see 24/7 availability become really a very limited thing, unless absolutely essential, and certainly it will be very expensive for us to operate in that type of a model in our region. I think that's larger than our region, but certainly here it's a major dominant factor. So we'll need technology to fill in the gaps. That technology is just not there yet. Technology will replace people, and I think it'll replace people out of healthcare first. So as I look forward, in the next 10 or 15 years, I do see that technology will catch up and will displace a whole host of other workers in other industries. We could look at over-the-road trucking as one example, with the potential of autonomous vehicles and other things. There are large swaths of our labor force that will have to be retrained in the years ahead, and healthcare, I think, will be a very likely option, but that will require a lot of resources and preparation for us to do that successfully. The second piece that's really dominant for us here in our region is that we're going to continue to get older and have slow overall relative population growth, and that squeezes on both ends. So the only demographic growth is in that 60, 70 plus range, and the workforce is going to be pressed the most as people retire and move out of the workforce, but then also as the demographics going through our educational systems continue to get smaller and smaller. So that pipeline is even smaller coming in to the workforce relative certainly to what's going out of it for sure. But that will be a significant play on what we need. So we'll have an older generation that will have a lot of service and support needs, but at the same time, less people to do that. And So that gets us back to the second slide that I was looking at. Third, healthcare is over $1 trillion of our economy. It's like 20% of the total GDP. It's enormous, and it's about 40 to 60% of that spending is probably what I would categorize as inefficient if you look at the data on that. And so there's a lot to be done to disrupt and innovate in healthcare over the next 10 years or so. And what that will be is that people will have to seek or look for and have available lower cost solutions that are more tailored to their needs. Which will require us as an organization to create lifelong relationships. We already do that in many respects, but that relationship has to be centered on a foundation of quality services when people come to access us, because they will have more choices, predominantly fueled by technology gains in healthcare. The fourth element is downward cost pressures. Again, value-based care is a big term in healthcare. People want high quality but lower cost. And that's going to be difficult for us to do with rising labor costs, as I outlined before, as we all compete for talent. So what that will require us to do as a healthcare organization is restructure our care models through a deep understanding of patient pathways. And when I talk about patient care pathways, we used to think as an organization, we used to operate in silos. So you have inpatient psychiatric care and you have outpatient psychiatric care. And it's no longer possible for us to think about encounters in each of those areas in a silo. We have to think about the individual and how they will navigate the different options for receiving care throughout the course of their illness. And so that's great and heightened care coordination efforts to be able to give them the right care at the right time at the right cost, but then also just being able to help them navigate healthcare. I think that's one of the greatest challenges anybody has, is when you have a chronic disease or illness, is finding a way to navigate the system. So as a healthcare organization in the healthcare industry, we have to be very good at helping people navigate that if we want to be able to survive in the future. And then lastly, more locally, is that the current state of affairs for our county partners is they're in a state where they're facing escalating cost pressures, with the cost to continue far outstrapping what their ability is to raise revenue through tax levy. They've been in a thoughtful deconstruction mode for over a decade with the levy limits. And that's going to increase not only our program oversight, but every program that government does, and threaten funding and the ability for government to provide programs and services. That does have an ability for us to be more efficient, more effective, but there's a saturation point that we're reaching at this point now, where we're actually getting into a situation where services and programming can be threatened if that continues going forward. So those are broad views in terms of things that are outside, I think, of our organization's control that we have to think about for our future and how we go forward. Ultimately, our playbook for going forward is based on kind of 5 elements. The first is the most important, and that's to build a culture that redefines human connection. And I think the pandemic makes this even more clear than ever, is that it's important that we all have human connection, and that's in person. Obviously, this mode today is effective in keeping us connected to some degree, but it is not the same energy as you have when you're in a room of people, and certainly connecting with conversation across the table from somebody. For us as an organization, when we talk about redefining human connection, every day when you have an interaction with the people you work with or the people you're serving in the community is either an opportunity to break or make a human connection. And for people to understand that when people come into our organization, it is often their worst day, and it may be the 1,000th time they've dealt with somebody with a bipolar diagnosis. And it can be challenging and frustrating, but for that person, it is their worst day, and we need to be able to create a human connection with every interaction that we have. If we do that in all regards with every human being we interact with, whether they're coworkers or community members, or most importantly, our patients, I think we will be successful no matter what. And then there are 4 real elements, I think, that cut across all of our programs and service lines. North Central Healthcare is kind of this conglomerate of different social programs and healthcare programs that cut across a wide array of different services that don't always make sense why they're all put together. But for us, these 4 strategies cut across all of our major service lines in some way or another. First is fundamentally we have to improve quality and reliability of our services. I'll give you an example. Whenever somebody's in a crisis situation, the team is fundamentally never the same. You have a different law enforcement professional, you have a different crisis service professional, you have a different patient, a different ER doc, a different nurse. The care team is always different. And within each encounter, that's the case. And our care teams are evolving and dynamic in all regards when we're dealing with our services. And so to create quality and reliability in an environment like that requires a lot of education, a lot of training, and certainly a lot of focus on high reliability type efforts. The second is we are fundamentally focused on expanding our mental health continuum of care, and that, along with that, our recovery programs. A lot of people believe that North Central Healthcare had a wide array of substance use treatment programs. That was not the case. We had a couple of things that we've done, and our mental health programs were not a full continuum. We were on both ends. We had inpatient hospitalization and emergency care, and we had outpatient psychiatry. There are a whole host of things that people need services in between those 2 points. And so we've been building that out and then integrating substance use treatment into all of that programming. So we've done a lot over the last couple of years, and the path forward for us is to have the most fully or the widest continuum of care and do that on an integrated basis going forward, having a whole host of complements from the most acute intensive behavioral health care to the most community-based model that you can provide, and building that all out across the spectrum. And the third element is to invest in and bring on new capital assets. That's our buildings, obviously, a key one, but then also looking at our technology. Technology and digital transformation is the core of what we're going to be able to do to be successful. So those are both things that we're bringing on in a big way. And then the fourth thing that we're focusing on that's a large strategy for us is managing the downsizing of an evolving long-term care industry. When I started here in 2014, we had a 220-bed nursing home. COVID has accelerated 5 to 10 year trends. We're operating today at below 130 beds, and our premise that we were going to operate a 176-bed facility, which when we designed it was built in, we had built-in pivots that we could scale that back all the way to 96 beds. I don't think we'll go all the way to 96 beds at this point, but we will certainly not be at 176 beds going forward. People fundamentally have looked at long-term care differently. Federal and state policy has shifted a downsizing and closing of skilled nursing beds across the nation, especially here in Wisconsin, where each day is underfunded by an average of $80 per day per resident for the Medicaid program. It's just causing, virtually a collapse of the system. Some of that is healthy as we move people into lower cost community-based settings, but the reality is that we will always need some level of long-term care availability, especially as hospitals start to discharge people quicker and need a reliable post-acute care provider that can take a higher acuity patient and then be able to treat them for a shorter period of time and then put them out into the community safely without the risk of readmission or adverse events happening. So fundamentally, what we're doing there is trying to focus on the higher acuity care and then integrating behavioral health. The number of people that have mental illness and recovery needs are getting older, and they will need longer-term care supports that we are distinctly and uniquely positioned to provide. So how do you put a building all around all of that and really make commitments to the tune of $73 million? Strategy is, everybody lays that out and with the best information available, you move forward and make decisions. For us, obviously, if we would have known COVID was coming a couple of years ago, we would have done some things differently. But fundamentally, I think the core of what we're trying to do on this campus is still key, because the most vulnerable do need access to 24/7 programming that is connected to this robust community-based service platform. But again, fundamentally, we have to have a future that is inclusive of a digital front door, so people can access us in multiple different ways, and then the integrated care pathways that I talked about earlier. So I'll come back to the project now, and this is where I'll show more pictures and give you guys a sense of where we're going with our campus. But our project goals are outlined here. Fundamentally, we wanted more efficient clinical operations. Our programs are scattered all over and don't make sense in terms of how to access them. We needed improved wayfinding. People get lost in our campus all the time. Security, we need to be able to shut this building down in under a minute. When I first started early in May of 2016, we had an event here that took us about 4 hours to clear the building. That's clearly unacceptable and a function of our facility as it is today, and so that's the second major component. We want to incorporate evidence-based design. Primarily, we need to move towards private rooms. If you were to come on our inpatient psychiatric hospital today, you could share a room with anywhere from 2 to 4 other people. That's just not contemporary or good care. We want to support higher acuity care, deinstitutionalize, and provide flexibility to adapt in the future, be more operationally efficient, increase our ability to be compliant with evolving regulations, be a leader in educational programming, which we'll get to in a minute with the residency program, and fundamentally give people quality workspaces. From Marathon County's perspective, they wanted high quality care, it to be financially sustainable, and then a comprehensive approach for the county. And what that means is we're freeing up a large part of our campus for the county to relocate a number of their other programs, some like North Central Healthcare, to this campus, and then be able to divest themselves of other property that are better positioned for hopefully economic development and non-governmental uses in the future. And that's exciting for a lot of reasons. So we kicked off our campus renovations in August of 2019, and it was to a small typhoon. I've got a picture of my youngest daughter and I, Josephine, here at the groundbreaking. You know, it was a great day, exciting day, but it was just, oh man, it hit just the perfect time, which was almost kind of a sweet, you know, kind of part of the story, especially relative to the groundbreaking being for the aquatic therapy pool. But we started in August of 2019 with this groundbreaking, and we've been busy ever since. In terms of our overall construction phasing, I'm just going to highlight this a little bit to let you know what we're working on. You can see the outline of the campus today. The coloring in the lighter green are parts of the facility that are going to stay. The darker green are parts that are new to the campus. And at the end of the day, there's a line here just to the left of this 1A. Everything south of that is parts of the campus that we're going to be vacating completely, and we're no longer in this building to the left side of the slide at all. So there's a ton of free space on our campus, and we're fundamentally operating at about 60% less of our space. 40% less of our space that we are today, which will make us more efficient, but at the same time expand our programming. So 1A was the aquatic therapy pool that was started again in August 2019. That had a duration of about 12 months. We got done as actually more close to 9. And then 1A, or this should say 1B, included our youth hospital, 8-bed youth hospital, which is the first county-operated youth hospital in the state of Wisconsin, or the only one today. And then there's a 16-bed crisis stabilization unit that's being constructed as well. So here was the design concept for the aquatic therapy pool that we went with. This is what it actually looks like today. So you can look in there. We are open and operating. We had to close a couple times for COVID, but you can see inside the facility it's just incredible natural light, very large pool basin, a number of on-deck changing rooms and exam rooms, and the locker rooms and private changing rooms are incredibly well designed. And then this is the entrance with the donor wall. So every single one of the 600 people, whether they donated $500,000 or $1, is recognized on this wall. We're very proud of that fact, and it's a nice way to enter the building and be able to see this facility. This is phase 1B. So on the left of this slide is the youth hospital, and on the right is the crisis stabilization facility. You can see the progress that was made late probably September was when this picture was taken. Both of these buildings are now complete. The youth hospital is open and operational. You can see inside the gathering entrance area to the youth hospital today. And again, that opened in October. We're fully operational. It's an 8-bed unit, and we've been averaging now about 6 people, a youth per day on it. You can look inside of this space, a ton of natural light. This this door goes out to the outdoor courtyard area, and the rooms are on the perimeter of the facility, and you can kind of see that in the next picture here. You can see the private rooms are all scattered across the outside with all natural light. It's a incredibly well-designed facility. We're very proud of it, and we've all but eliminated out-of-county transportation for youth mental health at this point. Phase 1B is our Mount View Care Center tower. That project started last year and will be done by July of 2021, so in 6 short months. We've been working diligently on that. This is the design concept. It's a 96-bed tower. It's meant to have smaller neighborhoods. The second floor will be vent and rehab, and then the third and fourth floor will be additional rehab, dementia, and some long-term care as well. The building is up. This is a picture Troy Torgerson, the project manager, and I took a couple weeks ago. It continues to move very quickly. There's a lot being done on the inside. The building is incredible in terms of the layout. The first floor area is going to have a community bistro and a coffee shop. So, you know, if you're walking through the neighborhood, Brad, you can stop in and get a cup of coffee with your wife and walk through our campus. I think it'll be a really nice feature to integrate and welcome the community into our campus. And then these are the views. The fourth floor views are incredible. This is actually taken from the roof, just so I had a better, clearer vision. But you can see Rib Mountain there to the left of this photo. You'll be able to sit from your room and be able to watch planes land and take off. And this airport is surprisingly busy during the day, so there's a lot of good action for people to watch. And then this is a view towards Lake Wausau and downtown. So the views from really all floors, but especially the fourth floor, are just incredible in terms of what residents will be able to look out and see. The next phase is our hospital and crisis and our residential treatment program that's slated to kick off here in April of this year. That's a 9 to 12 month project. This is going to have a completely redone crisis and hospital environment. It's going to be state-of-the-art and really exceptional, and move us a long way in terms of quality and the scope of crisis care that we're able to put into our community. And I'll come back to that here as we wrap up. Phase 3 is the Mount View Care Center remodel. This part of the building will have very little skilled nursing left in it. It will be more of a converted to more of a medical office building. Our outpatient services will go there, as well as our administration and some longer-term care programming, but not much. And that's slated to kick off in August of this year. So if you're keeping the timeline straight in your head, yes, we'll have 3 major projects going on all at once. It's going to be an interesting year, to say the least, but we've got a good plan and a good team and a good partner in Myron to get us through that. And then lastly, phase 4 is our parking lot, entrance, and docks that we'll have to do, and we'll wrap that up next year. And we'll be celebrating our 50th anniversary next year, and the completion of this entire project is slated to be on time and slated for next year. So we're very excited about that. So in the few minutes I have remaining here, before I take your questions, I just want to touch on the psychiatry residency program. When you think about community and the importance of people putting in the extra effort to do exceptional things in this community, the fact that we were able to bring the Medical College of Wisconsin and their medical school to this community will be transformative. For people that don't fully appreciate that today, if you continue to watch it over the next 10 to 20 years, that is one of the most transformative things that could have ever happened to our community. We will be the basically medical hub for all of north central Wisconsin and up to upper Michigan. And that is going to be enabled by the ability to have a pipeline of people going into the medical school here locally. I put it on par with the insurance industry and the lumber industry and being transformative in this area. So as part of that, the Medical College wanted to train rural psychiatry and psychiatrists through rural psychiatry programs, both in the Green Bay area and central Wisconsin. Central Wisconsin won the ability to do that because of the Medical College being here in Wausau. That was really a major catalyst. And North Central Healthcare. If North Central Healthcare wasn't supporting this program, it wouldn't be here today. And as we look at that program, in 2015, we didn't have a program at all. We've been busy building that program to bring in 3 psychiatry residents per year. The residency training program is a 4-year program, and the idea of this program is that the residents will go to school here, hopefully at the Medical College of Wisconsin, and then be able to do their residency program here in Wausau, and then hopefully stay. The data shows that about 70% of residents tend to stay where they train, and that's the whole benefit of this program. But to be able to do this, we also had to recruit a number of supervisors and training psychiatrists to be able to support the program. And in 2015, we had very little. And if you look at this slide, this is the number of psychiatrists that we need to be able to meet the needs of our community. In 2015, we needed almost 14 new psychiatrists. We've closed the gap, not including our residents, over the last 4 years to get that down by almost 10 psychiatrists by really North Central Healthcare efforts almost alone. But then there's been other psychiatrists that have been brought in the community, some to Aspirus, and then Ascension as well. But really the focus has been here at North Central Healthcare. And Dr. Rob Guthrow is a key part of that. He is our Chief Medical Officer and Program Director for the Central Wisconsin Psychiatry Program. Rob's been with us for almost a year and a half now. And remember this man's name. He will transform the behavioral health services here in this community. He's an incredible guy, and he's doing great things with the program. But more than anything, this means psychiatrists and people here in our community. Here are 11. There are actually 12, but one of the first-year students went to Milwaukee to do her child and adolescent fellowship, so she graduated earlier. So we've already graduated one of our residents. But these 11 individuals weren't practicing psychiatry 4 years ago. They weren't in our community 4 years ago. And now we have 12 people rotating through our medical community, providing psychiatry as they learn and develop their skills here in Central Wisconsin. Most importantly, you see two gentlemen, Boris here on the left and Jordan, on the bottom right, those two gentlemen there. These are our first two residents that came directly out of Medical College of Wisconsin's medical school here in Wausau. So they came to Wausau to do their medical school, they graduated, and they matched and came here and did our residency program. So the pipeline is fully open now in terms of what we had envisioned, and that is all coming together. But these 11 residents are changing our community already, and hopefully will stay long term. And then these three individuals are our new physicians that are joining this organization this summer. Dr. Hoppy and Dr. Yassine are coming out of the Medical College of Wisconsin. They're, sorry, there's an announcement on our phone. I'm sorry for that. I'm sure you guys couldn't hear that, but it was an emergency alert from our alert system that they'll take care of. That's fine, but I can't talk while it does it, so I apologize. But Dr. Hoppy, Yassine are coming out of the Medical College of Wisconsin's residency program in Green Bay. They did their initial training with Dr. Guthrow, and so we've hired two of them out of that first class. And then Dr. Dotson's actually finishing her residency in Kentucky, but she is a Mosinee resident that is returning home now because of our youth hospital that is up and running. And so she's coming back and will be a child adolescent psychiatrist here in the place where she grew up, which is incredible. And so right there you see new faces being added to our community. And the last piece that I'll just touch on real quick are other points of interest. I highlighted what we're trying to do with our behavioral health inpatient unit and crisis services. Essentially what we're trying to accomplish is having the state's second psychiatric ED. This first one is in Milwaukee County, and in Milwaukee County, 90% of medical clearances and psychiatric needs are met by their psychiatric ED. Today, here in our community, when somebody is brought in for an emergency detention for a psychiatric crisis or stabilization need, they have to go to the emergency room to ensure that they're medically stable to be able to admit to our hospital, because we do not have the full capacity that an acute care hospital has if somebody needed higher medical needs. That ties up law enforcement through the entire process. It's really unnecessary care in the EDs, and ultimately is not a great experience for patients. We'll be able to do medical clearance and a lot more stabilization along with 24/7 psychiatrist coverage, and we'll be one of the only places in the state of Wisconsin that does it for our region come this end of this year. The facility will enable us to do that, but all of those physicians that I showed you are part of that solution as well, and that's really incredible. And then the last piece I just want to highlight is many of you have probably read about our homeless pilot and what we've been doing there. And I just want to use this for a point of emphasis in the community work that we all do. There are major problems that we are trying to solve as a community. All communities have them. And the point of the homelessness pilot in my eyes is that as we were discussing what to do with homelessness in our community, that is a very wide-reaching issue. There's a lot of definitions of homelessness. There's a lot of things that we could be doing. There's a lot of great things that people are doing. But when we were working together with United Way, it came clear to me that we need to narrow our focus. We need to be really targeted and really defined and articulating the problem that we're trying to solve. And for this particular pilot, we had 16 or so individuals in the downtown. So from 3rd Street to 3rd Avenue and from Thomas Street to Bridge Street is where we are going to focus this pilot. We are going to focus on solving homelessness in this specific area with these specific individuals. So we started with going and identifying who these individuals were. We cross-referenced that with a list of people that we've worked with here in our organization in the past. Some people were current or previous clients of ours. And then we said we are going to work with these 16 individuals to move them out of homelessness and into stable housing and get them access to treatment. We've done all that and more just by leasing a home through a grant of the B&A Esther Greenheck Foundation and assigning one full-time person of ours that's a case manager and a one-time full law enforcement agent. These are types of solutions that I think our community has to look at going forward as we try to solve big problems, is not to get overwhelmed with trying to solve the entirety of problems, but really trying to break down and define clear problem statements and work those so that we can show success and then build upon those. And I think that this pilot that we've been doing over the last year is a great model of assertive community treatment and will allow us to do a lot and build upon and ultimately provide a lot more solutions in terms of homelessness. And as I end up here today, I'll just throw this up here. This is the dedication that I wrote for our aquatic therapy pool. And the first paragraph, I think, is the most operative in terms of this conversation we're having today. And North Central Healthcare, I think, is doing a lot of great things. We do a lot of great things because people support us and believe in where we're trying to go. But what we need from this community is a lot broader than what we can do in our four walls. And I think that's where all of you come in both your professional and personal lives and what you support. I think about projects like the downtown mall repositioning. I think about the Early Years Coalition and making Wausau a great place to live. I think about our school districts and innovating to keep students here. Those are the kinds of solutions that, as an organization, we need now more than ever. We need to make this community a great place to live, work, and raise a family. Without that, North Central Healthcare can't continue to do the things that we're doing today, or let alone the possibility and opportunities that I think we could do in the future. And that's where we need all of your help and all of your leadership. So I appreciate all the work that you do in our community and certainly look forward to having you support our organization in any way you can, either directly or indirectly. Thank you for hearing me out and covering a whole host of topics today, and I'd be glad to answer any questions anybody may have at this point.
Thanks, Michael. Great presentation. Questions for Michael?
Mike, is Dr. Kroll still involved in the residency program for behavioral health?
Dr. Kroll is still involved. He is no longer the full-time program director, but he does do some associate work with Dr. Guthrie and still supports it. We would have never been here today without Dr. Kroll's commitment. He was the founding program director for us.
Michael, this is Matt. Can you comment at all, or is it, I guess, where is it at in the process in terms of, you talked about the, call it the southern half of your facility and it being maybe it's going to be vacated essentially, but then perhaps reoccupied by other county services. Have those been defined and determined, or is that still a work in progress?
I mean, it is still a work in progress to finalize it, but you can count on, I think, from the county's perspective, they want to put social services out here. And I know that there are other programs as well. That has not been, discussed publicly or finalized as a plan, but they've already done some preliminary design work for social services specifically. What comes in addition to that is yet to come, I think. Okay.
All right. Thanks.
So
we've got about 3 minutes. We've got about 3 minutes left. Any other questions?
Along those lines, Matt, to Mike, what's the status of the county health department? Are they still an occupant in that campus?
They are, and I think that they're going to stay here for the long term. Okay. We had to open up a bunch of temporary space for their contract tracing. I mean, they essentially doubled the size of their department for a better part of the pandemic.
How much of the current complex will be raised when it's all said and done with all the building completion projects?
There would be only 2 pods that would be raised. So one single story, 1970 pods that are just really outdated. One's already down, and then the second one will come down at the end. very little relative to what we're doing.
In the current design of your campus, everything is connected. You can travel from one end to the other internally. Is that going to be the case with the new campus?
Yes and no. For staff, that will certainly be the case. For the public, if you remember the kind of the big parking lot out in the new area, there's only one hallway with 3 doors that you can get into, that you can access one hallway. So it's very limited, which will make it easy to navigate and certainly safer for us to lock down.
Okay, any other questions? I'll just close by kind of reiterating, Michael, I think it's tremendous what you and others have done in terms of the psychiatry program and behavioral health programs in central Wisconsin. I, from past experience, know what a challenge that was and is for many areas in the country. It's a national challenge. And I guess, you know, I knew some of this work was going on, but your presentation really illuminated it for me that we've really made some great strides, and kudos to you and your team for that. That can really be dynamic changing for central Wisconsin, really. So.
Yeah, thank you for that. It will be, but just so everybody, you know, can keep this in front of you, and you probably already are experiencing either personally or professionally or through your connections. But the 4th wave of COVID is mental health impacts. We're seeing it in the number of suicide attempts and completions. We're seeing it in the number of people accessing care. It is really kind of a crisis in terms of what's needed out there right now and how much people are struggling. So please, you know, this will be a priority for our community for a long time, unfortunately, because of COVID, and that's on top of needs that were already being unmet.
Sure. Okay. Well, thanks again for the presentation. JB Chadwick is on board to take us home with the 4-way test. JB, the floor is yours.
Sure, thanks, Matt. So the 4-way test are the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it bring goodwill and better friendships? Will it be beneficial to all concerned?
Okay, thanks everybody. Have a good week. We'll see you. Take care.
Thanks, Mike.